Good morning, everyone. First and foremost, thank you, everyone, for being here. Thank you to Mayor Dr. Victor Trevino for giving us this opportunity, his beautiful wife, Rosa Marquez de Trevino. Welcome, City Secretary Mr. Mario Maldonado. Thank you for joining us. Ms. Laura Ñañez from American Cancer Society, and family and friends. Just bear with me because this is the first time we do it here at the city and it's very different. Good morning, everyone. Thank you for being here. My name is Patty Vela, and my husband is Ruben Vela. He is a pancreatic cancer survivor, stage 3. Our journey began in 2019, a year that we will forever be remembered in our memories as a testament of the power of resilience. Our two daughters were seniors in one was in high school and one was in college. To us, it was going to be the best year of our lives. Unfortunately, the world had another plan for us. My husband started feeling ill, and quickly we scheduled his yearly physical, which was long overdue. When he got to the doctor, unfortunately, it was one bad thing after another. He was sent to get some blood work and some scans. Unfortunately, more bad news. A week after that, he was hospitalized. He was fully jaundiced. I was living with a minion. The doctors here in Laredo were baffled. They were uncertain of what could it be, even though they knew. A doctor came into our room and told us it could be cancer, but we needed further testing. And unfortunately, Laredo is medically underserved, and we weren't able to get all our testing done here. He told us, there's not much we can do. Enjoy your time. We quickly made calls. San Antonio answered our call, and we quickly transferred over there. Unthinkable, the worst was confirmed. It was pancreatic cancer stage 3. I had heard cancer. I didn't hear pancreatitis. I really didn't know much about it at that time. The first thing I did was I got my phone and I started researching. Worst thing I could have done. With very little hope, we embarked on this horrible journey. Fortunately, my experience as an American Cancer Society volunteer really helped me. I immediately called the 1-800 number, and they sprung into action, providing us numerous guidance and immediately starting helping us with hotel stays. They connected me immediately with PanCan, another organization that helps victims, well, I should say survivors, that are going through pancreatic cancer. This organization started opening more doors for us. Throughout this ordeal, Ruben underwent 27 rounds of chemo, a major surgery called the Whipple, 32 rounds of radiation, and 8 more rounds of preventive chemo. 6 long years of ups and downs. But yet we remain determined to make a difference in the lives of others affected by cancer. This Cancer Awareness Month, PanCan is inviting us to shine a light on pancreatic cancer to let us uplift survivors and those living with this disease, honor the lives of those we've lost, and help everyone recognize the risk and the symptoms. And together we can spread awareness about this disease. We need to celebrate progress and inspire hopes in others. At this time, Mayor, any other words?
Good morning, Dr. Victor Trevino, Mayor for the City of Laredo. It's an honor and a pleasure to be here to stand before you as we observe Pancreatic Cancer Awareness Month. Pancreatic cancer remains one of the most challenging and aggressive forms of cancer, and raising awareness is very important. It is vital to improving early detection, research, and support for patients and their families. Now, a little bit I might add on my part, being a medical doctor. We've seen many pancreatic cancers, and regretfully, once it's symptomatic, it may be too late. So, with initial blood tests, such as pancreatic enzymes, which is amylase and lipase, we're going into the medical part, but I think people should know this. When you get elevation of pancreatic enzymes, it could be chronic pancreatitis or just a viral infection, or it could be pancreatic cancer. So when we have elevation of pancreatic enzymes, we don't leave it there. We can follow up and do repeat tests to see if they're still elevated, but the main thing to do is to get tumor markers. That was not available in the past. Tumor markers are indicative of whether or not there's cancer in the pancreas. Now, tumor markers can also be present when there's chronic pancreatitis. Like people who may drink a lot of alcohol get chronic pancreatitis, people with viral infections. But what we do then is proceed to do an ERCP. What is that? Nobody knows that. It's an endoscopy that goes into the stomach and it goes into the small intestine, finds the common duct where the bile duct and pancreatic duct get together, go into the pancreatic duct, go into the pancreas and get a biopsy. This way it's confirmed whether it's pancreatic cancer or not. At very early stages, before it's symptomatic. And those are things that we can do as a prevention on the medical side. But I think people should be aware of this so they can ask their doctor to see if they can get that done. Because if nobody's thinking of pancreatic cancer, by the time it's there, it's too late. By the time it's symptomatic, by the time they're jaundiced, it's too late. So we need to get the information to the public, and you can pass this along to get pancreatic enzyme, tumor markers, and endoscopy with a pancreatic biopsy. So that's a little added information. Now, Laredo, we need to be vigilant and be committed into fostering education of the risk factors. Risk factors are also family history, alcohol abuse, consumption of other medications that might cause that, and the importance of early screening. By coming together, we can share hope and advocate for more funding and research and advanced treatment options, like chemotherapy when it's early enough. Let us take a moment to honor those who have been affected by pancreatic cancer, and those who have fought bravely, and those who continue to inspire us with the resilience and courage. And as mayor, I want to thank you for your commitment of raising awareness and supporting these or those who are affected by this disease. And together we can make a difference. But more importantly, pass the word along, get people educated that there are things to do before it is symptomatic, before there's no signs at all. We can diagnose it with the measures we just talked about. Thank you very much. Want to read the proclamation?
You can read it.
Oh, sure.
You're a professional at it.
All right. Office of the Mayor, City of Laredo, Texas, proclamation. Whereas in 2025, an estimated 67,440 people will be diagnosed with pancreatic cancer in the United States, and 50,550 will die from the disease. Whereas pancreatic cancer is the third leading cause of cancer death in the United States and is projected to become the second leading before 2030. And whereas pancreatic cancer is the only major cancer with 5-year relative survival rate just 13%. And whereas when symptoms of pancreatic cancer present themselves, it is generally a late stage, with the average patient living only about 1 year after diagnosis, while only 10% of the patients with early diagnosis become disease-free after treatment. Whereas pancreatic cancer is the fourth most common cause of cancer-related death in women and men across the world. Whereas disparities by race, socioeconomic status exist in the diagnosis treatment of pancreatic cancer, improved understanding of underlying causes could inform interventions. And whereas the good health and well-being of the residents of Laredo are enhanced as a direct result of the increased awareness about pancreatic cancer and research into early detection, causes, and effective treatment. Now, therefore, I, Dr. Victor Di Trevino, by the virtue of the authority vested in me as Mayor of the City of Laredo, County of Webb, State of Texas, do hereby proclaim November 2025 as Pancreatic Cancer Awareness Month and November 20, 2025 as Pancreatic Cancer Awareness Day. Thank you. All right, there we go. Let's get a picture.
Voy a tomar una más de este lado. ¿Listos? Una, dos y...